Hi, my name's Arielle Ford, and welcome to Meet the Experts. Today, my special guest is a healthcare professional named Annette Tersigni, who's known as the Yoga Nurse. Welcome, Annette. So nice to meet you.
Pleasure, Arielle.
Okay, so I have to know, what is a yoga nurse?
What is a yoga nurse? A yoga nurse is a combination of a registered nurse, I'm a registered nurse, and a yoga professional, and I'm a certified yoga teacher. So it's a perfect marriage. So you take ancient yogic science, you marry it to modern nursing science, and you get a tremendous formula for healthcare for today.
So what does that look like? I'm in the hospital, I had emergency appendicitis, and yoga nurse walks in. How is that different from, I'm going to take blood out of you, nurse?
Yoga nurse has awareness and is more conscious of your needs. And a yoga nurse is really caring for your heart and your soul. And I believe that if I'm not touching your heart and your soul, there is no healing. So if I may be so bold to take your hand, nurses today don't even have time to touch. A yoga nurse really knows and is reminded that when we make that connection, that's going to the heart of the inner nurse healer.
Well, that's really wonderful, because I remember when I did have an emergency appendectomy, the only person who actually touched me was my husband, or they were taking blood out of me. So it would have been nice to have a compassionate person come in and do something else. Do you also do yoga exercises while somebody's incapacitated or in bed?
Yes, exactly. You know, bedside nursing today, we have to remember that a lot of times clients are in pain, they can't move. So we do what's called range of motion. So that's the traditional name for moving people. However, in yoga, a yoga nurse is going to apply breathing exercises as well as teaching simple techniques that you can do in your bed. I show all of that on my website, how you can do really easy stuff in your bed, in your chair, or at your office.
So what is your mission exactly as the yoga nurse?
My mission, if you can imagine, is to create and train a global army of modern nightingales. That's what yoga nurses are. We're modern nightingales to uplift the ailing healthcare system, to relieve chronic anxiety. We're going through a period of chronic anxiety. The whole world is suffering from chronic anxiety. To relieve pain and suffering. And I guess the most important part for me, because I love to expand consciousness, is to really help people to enlighten up.
Oh, that sounds great. If I ever needed a nurse, I definitely would want you next to me. Well, tell us about some of the unique things that you do in your work.
Well, today, I'm very focused on training other nurses to be yoga nurses. I'm getting inquiries from nurses all over the world and yoga teachers who want to learn my specific brand of yogic nursing therapy. So I've created this new field in healthcare, and I'm creating a curriculum. I'm actually writing a book called Yoga Nursing, The Art of Caring, and I'm training other nurses. I just launched Yoga Nursing, Intro to Yoga Nursing at the Kripalu Yoga Center, and I trained the first 14 yoga nurses from the United States and Canada, so now we have other yoga nurses who are doing what I do. Kripalu loved it. They're having me back. It's expanding. That's one of the things that I'm doing. I've created a CD that I've been selling for years that is really simple. It works. I'm producing a documentary for cancer survivors. I've been working with breast cancer survivors specifically for years. And I'm doing a documentary on the group that I'm teaching in the Outer Banks of North Carolina. And finally, the gig that I love the most, that really really is me is my new series called Couch Potato Yoga.
Oh, wow, that sounds great.
And Couch Potato Yoga is to help people to get moving and to enlighten up, because we have an epidemic of couch potatoes. I play 3 parts. I'm the yoga nurse, I'm the yoga ma, and I'm the yoga wench, and it's all to help people to enlighten up.
Oh, it sounds great. Now, with these other yoga nurses that you've trained, can you share a story or two with us of how it's changed their practices?
All right. Yes. Well, I have so many stories. Let me try to focus in on one specifically. There are yoga nurses in my local area and yoga nurses in Canada and the United States. And really, these people are from all walks of life. And what they do is they learn how to apply 3 basic techniques. It's very simple. First of all, anybody can do it. What do yoga nurses do? What do we teach? We teach you how to breathe, to stretch, and relax. Now, how hard is that? Can you breathe? Mm-hmm. Can you stretch? Can you relax? So everybody can do that. Secondly, it works. We have testimonials coming out the yin-yang with all due respect. Blood and measurable, because in nursing it's science, so they want evidence-based practice. Right. So we have the evidence. This is measurable. Blood pressure decreases, heart rate decreases, immune system strengthens, range of motion increases, pain decreases. I could spend the rest of the interview going on with the benefits, and it's all documented in health department and online with our government, as well as really recognizing that yoga therapy is working. And really, the bottom line is, can people do it? And I've worked personally with nearly 4,000 people in my practice in Canada and the United States. Arielle, have you ever gone to yoga class or a fitness class? Mm-hmm. You go into the class and you're partway through the class, and all of a sudden you go, oh no, I think I'm in the wrong place. I don't really think I can do this. This is way too much for me.
That usually happens 5 minutes in for me.
Okay, so you get it.
Sure.
I mean, that's happened. You found that you were
Yeah.
in the wrong place. It was too much. And you see, for me, that's the key. When people come to my sessions, I want them to be able to say, I can do this. Mm-hmm. And you know what? I hear that after every session. I have boxes and cards that touch my heart from people that say, Annette, I can do this. This is changing my life.
So for people who want to find a yoga nurse or to become a yoga nurse, how do they find you?
Okay, well, they find me at my website, yoganurse.com.
Oh, that's way too easy. All right, well, we don't have all day. I wish we did. It's a fascinating topic, and thank you so much for being with me today. It's just been a delight meeting you.
Delight.
Yeah, and I need my own personal yoga nurse, so, if you move to La Jolla, you'll have a job.
Oh, yeah. Tempting.